So, Charles, now we are in a situation where I am in Chartham.
Yeah, 1 second. Part 3, part 2 we screwed up. I screwed up with that one, not with this one. I'm here with Dr. Wlodzimierz Sokolowski, and he's Polish and came to Canada in 1971, right?
He is a Canadian. Canadian with a Polish background. That's how you say.
It's funny how I meet some
Okay.
people, some person from India, and I say, "Where you from?" They look at me, they say, "Canada."
Sure.
So, what you asking me for?
Actually, this is what Canada wants. Okay, it wants that if you arrive here, if you are becoming a citizen, that you have an allegiance to this country.
Yes,
right?
and that's what you thought. That's what you
are
are doing.
allegiance to this country. In Poland, there are very many different races and different nationalities. And for instance, Germans. The Germans were coming to Poland, say,
In 1940.
No. In the end of the 19th century, and Polonized, and they were extremely patriotic. They spoke German, and for instance, on the side there was a very big officer in the underground, which was German in the background.
And that could take another 2 hours. You came here, you land here.
Okay, but let's
Yeah,
because that's what you did, a digression. Okay?
I know.
It is a digression. That's all right. It's your recording.
Exactly. It's you're the producer. I'm surprised.
You are the producer. You are recording it.
You're the director. I'm surprised I haven't been kicked out from this house yet. Okay, so we're gonna go. You arrived here in Miramichi, and you were told, asked by an administrator from the Miramichi Hospital to come here as a, what do you call it?
Anesthesiologist.
Thank you. And then you arrived here. You had 4 or 5 months of training.
10.
10 months of training, which you weren't qualified. Were you?
Here is the problem. On one side, they declared me as qualified and they hired me. On the other side, they assumed that I am unqualified. So it's a type of hypocritical situation in any case, and very treacherous. Okay.
Did you do any work?
What?
In those days, when you got here, your trade that you weren't qualified, did you do any?
You are interrupting me because
God,
I have a chronology to develop the situation. Okay, so
go ahead.
So you.
I'll shut up. There.
You have to be patient.
Yes.
So, in other words, repeating myself, I am here as an up-to-date trained anesthesiologist, and the people, the administration, and the doctors in charge do not believe I am qualified.
Okay.
So it makes the situation crazy to begin with.
Mm-hmm. And you needed money.
And I needed to work,
yes.
not to need money.
The wife saying,
Two kids. I needed to earn a living.
Yes.
As every human being.
What did you do?
I have had some loan, so you could have that. But here, we are not talking about money, we are talking about the attitude, the terrorist attitude to me, which creates such a situation. And here, they know or they assume that I am unqualified. Incompetent.
Yeah.
And they are reluctant to expose a Canadian citizen to my anesthesia because they fear that I can hurt the patient. But eventually they decide that we have to do something and let him show his incompetence or his competence, whatever you like. Okay?
So how many people did you kill?
So here the first case, on the 4th day, they gave to the dentist. not the doctor, the dentist. A very prominent fellow here, very prominent, a veteran, World War II veteran, very nice gentleman. And he also was reluctant to let me have do the anesthesia about his patient. So, but he was, smart, so he did not choose a Canadian citizen, he took an American doctor who was a hermit in Rogersville at Trappist. Trappist, the
I've been there. I've been there for a week.
For retreats.
Yeah, yes, very good. Have you been there?
No.
Okay.
I have been here, but not for retreats.
Maybe that's what you need, a week. They're good, they're monks.
Yeah, I know. Next time we go together.
Oh my God.
Very good.
Okay, continue on.
For the retreat. So this patient, his doctor, brother Anthony, he was the first patient of mine. So they sent me, doctor will do oral surgery on him. So, to prepare the oral surgery, I intubated him through the nose, which is quite a tricky business. You have to make him unconscious, to thread through the nose to the trachea, and then you have oral cavity opened. So the surgeon can do everything. The tube is not bothering him, because there is a tube. The tube goes through the nose and behind this. So I intubate him and waiting that the surgery is going to last at least 1.5 an hour.
You did it, right?
Yes,
Okay.
yes. 45 minutes, and the dentist pulled one tooth. It took him 1 minute or 2 minutes, plugged it, and he said, that's over. So the whole work, it was 5 minutes.
Yeah.
5
And
minutes.
how long?
5 minutes. So now I earned $25 for the whole
But the
shebang. For the shebang.
and $35 in those days was a lot of money.
$25 without taxes, the whole day, the first day after a week or 5 days waiting. So don't tell me, okay, that it was some money. It was nothing, okay? But the patient was home. And obviously nothing happened to him. So the other doctors started to give me work and patients, one after the other, and so and so. And I started to work, not 1, 2, 3, but day and night, because I was actually alone. There was a lady who was doing anesthesia, English lady, but she was in a childbearing age. Okay, so sometimes she went to have a child. She could not work. Obviously, she could not take calls because she was either pregnant or just delivering or so. So I worked day and night, on call, 24 hours, 7 days a week.
At the hospital or the
in
dentist?
the hospital.
So you passed the test with the
No,
with the
just
dentist.
hold on.
Okay.
I'm talking about working.
Yeah.
I hired you as a worker, and you work for me 24 hours, day and night, for 6 or 7 months. You understand? So in other words, I hired you, but actually you are a slave. You understand?
Yeah, well.
You are a slave. I give you privileges that you can earn some money, but you are slaving. You can't go anywhere. We could not go to Montreal because I was so busy. What it means that as soon as I came, they assumed that I can do not anesthesia. But later they have found that I can do all the anesthesia, every anesthesia. So gave me so much work.
Overburden.
I could not stand it.
Yeah.
Okay?
Yeah.
I could not stand. But they still wanted me to trip and to fail.
Okay, got it now.
Okay?
Now-
So this is a conspiracy.
Let me go back one
This
thing.
is a conspiracy against me on the expense of the Canadian people or the Miramichi.
Okay, now, when you did that little job for the dentist, we're not going to mention his name, I presume, and then when was supposed to be for 45 minutes or an hour or whatever, and it only lasted 2 minutes,
Yes.
was that the only job you did with the dentist? They said, oh, he knows what he's doing?
I would say so. You can say so.
Yeah. So that was your
So in other words,
next step.
the dentist was testing me.
Only one test.
One test.
That's it.
Yes.
That's it. So
And then the rest of the surgeons started to use me or me to give anesthesia, and I developed from starting slowly, but then I have so much work.
nervous breakdown, maybe.
I was overworked.
Yeah. You're stressed out.
No. I was
Overworked, yeah.
because the demand was such. Now, if you hire somebody and you can use it, and he's doing playing a good service, would you waste him? Would you?
Oh no. You know.
Unless you have a criminal intention, unless you're a psychopath.
So they wanted you to screw
Unless
up.
you're a psychopath.
You're trying to tell me you were so
There are
tired.
psychopaths here and the criminals. That's what I told you. I am telling you.
You're telling me that you were so overworked and all that they did that on purpose. Number one, to show you that, oh, he failed. And number two, you
No.
want to be knowing what you're doing so you could kill people.
No. You don't understand.
Sorry.
First of all, they assumed that I cannot do anesthesia. Then they have found that I can do anesthesia.
Yes.
And they needed anesthesiology. So they were not using me. They overusing me. They enslaved me. And I was working day and night. And instead of me being allowed to put my roots here, to be appreciated, to have my family, accepted, they were conspiring to waste me. Okay, so it was a trap.
How long did you work?
It was a trap.
How long did you do that? Till 1973?
No.
74? I'm
Just
just trying to follow the time frame.
No, you
That's all.
you have difficulties following because you're jumping too hard. We are still at the year, I came here 73, we are talking a year 1974, okay?
1974.
Yes.
So you came here, that'll be the end for me.
Yeah, everything is there. And now listen to this. So now we are in 74, and they still use me as a slave, overuse me, but still want to waste me. But they have difficulties because your doctors having so-called, type of morality, or the hypocrites, obviously, and so. And the conspiracy against me was not only here in Chatham, but all over New Brunswick and I would say Ottawa as well. But we are not going to go it. So they have found that they could trap me in Bathurst. So somebody says, look, one day if you are not too busy, go to Bathurst. And they invited me to go over there. And I went to Bathurst. And the first day I worked with a urologist, prostate and so on. And he was doing prostatectomy. I frozen the client from here to here. So the patient was fully conscious, painless. And the surgeon was extremely happy because the fellow who worked there was unwilling, unable to do this. So this doctor, his name was Murphy.
Oh, we got a name. My God. Okay.
What?
We have a name. Okay.
Dr. Murphy.
Okay.
And he said, oh my God, so you're doing great anesthesia here. I will invite you again. And in a couple of weeks or so, I got a call from Bathurst. Let's come to Bathurst to do the work. So one day I drove down there. And before you enter the operating room, you have to change, okay, to the greens. You take your rugs out of you, and you turn a clean shirt, a clean pants, and so on. Everything clean and sterile and so on. Okay, so you are changing in the locker room. Yeah? In the locker room, the door is opening. It was opened, and the gentleman shows in and says, "I am Dr. A.B." No name here, okay?
Mm-hmm.
No. I'm Dr. A.B. You are going to work with me. So he addressed me like I was a farmhand,
A what?
A farmhand.
A farmhand.
Farmhand. You know what's farmhand?
Oh, go ahead.
Farmhand is a fellow you just
Give orders.
give orders.
And you will listen. Slave boy. Slave boy.
a slave. You move the manure
Yeah.
from this to
Yeah,
that.
yeah,
That's
got
a
it.
slave.
Oh, okay, got it.
Okay? Farmhand.
Got it.
Okay. So, obviously I didn't have anything to say. He didn't shake hands with me. I entered the operating tract. And
Did
there
he
is-
listen to you talk before he?
No,
He
he
didn't
didn't
know.
talk to
He
me.
didn't know you were Polish.
No.
Okay, go ahead.
He didn't talk to me.
Okay.
I'm entering the operating room and he says, the nurse tells me, okay, we are going to have a Ramstedt procedure. This is, to be short, it's a infant, 6 weeks old, 6 weeks old, 6 or 7 pounds. The child has a blockage. It's a blockage, okay? The duodenum not allowing the food to go through. Pylorus is over the muscle. Pylorus is a valve behind the stomach.
But that's no concern of yours. Your concern is to put the baby asleep, right?
The baby, and the pylorus, and no, the baby. So the baby is starving. Okay, the baby is starving, and if you don't cut the muscle, the baby is going to die. As soon as you cut the muscle, the food can go, and the child is thriving on their own. And this is called a Ramstedt procedure. But this is a problem that is the kiddie was 6 weeks old. I have never ever done this type of anesthesia, never. So now 6 weeks, I killed the 6 weeks old child, okay? Some Acadian or some other. And
But baby died?
he didn't ask me if I can do it. But I was in a position to tell him, sir, I'm not going to do it. But it will be an admission that I cannot.
No, you're not qualified to do that.
You're right.
Yeah.
But I said, okay, I'm going.
You did it?
Oh, yes.
Oh, now you got my attention. What happened?
Oh, yes.
What happened?
That's the most interesting part.
Oh, yes, I bet it is.
So I am inducing the child, inducing him put to sleep, okay? Just with gas, which is very easy, because if you give a mask, then you're asleep. That's it. Obviously, it's not very comfortable. So if I would give you anesthesia by mask, you wouldn't like it. You prefer to be put to sleep by
We're
injection.
talking about a 6 weeks old kid. Okay, go ahead.
But the child is small, so it's very easy for me to anesthetize. And the child is now having the 6 weeks old boy, which is 7 or 8 pounds.
Yeah.
I have in front of me, I have his head here, and his chest here, and the surgeon is here, not very far from me.
Yeah.
But all the time I have to monitor the child, okay? So I have my stethoscope, which is not too long, so I have to bend here and listen to the heart and to the lungs of the child.
Yes.
Because this is the way how you gear your anesthesia. If you go too deep, the heart rate will slow, so slow down, and if you go too deep, obviously you can kill the patient. And then you have to pump enough oxygen, enough air to his lung that he will be oxygenated. Not too much, not too little.
This is like some kind of what
this is what it is. And
can't wait till the end here.
yes, here is it. And the surgeon, obviously being responsible for the child, being very responsible for the child, is very anxious, and he doesn't know what to eat. So every 2 minutes he turns to me. How is he doing? I said, he's fine. Yes. So I can go ahead. Yes. And so we started to do something, and I see the child is doing fine. Now, if the child being not paralyzed, and he will knife him because he has to open his belly, okay? The child would react.
Duh.
No. Well, grimace.
You would react. I would react.
No, the child will react as well. Everyone, if you knife any animal, you will react.
I get it. I get the picture. I'm sure we are getting the picture.
Yes.
Okay. So what happened?
But now, say the child is knifed, the surgeon opens the belly, but the child doesn't respond at all. He's doing perfectly well. His heart is fine. His lung is... So,
I told you I have ADHD.
No. And so, every 3 minutes the surgeon asks me, how is he doing? I say, oh, he's doing all right.
What is this? Some kind of soap opera of another world?
Yes.
Oh my God! I gotta wait till the commercial. I can't wait.
Wait, here's the moment. You see, we are wasting our time because you are interrupting me
I know that.
too
Sorry.
often.
You got some Ritalin? You're the doc. No,
So you're
marijuana. Okay,
no.
go ahead. Okay, the doc. Baby is going fine. How is he doing? Fine.
Yes.
Fine. Go ahead.
You see, every 3 minutes he's asking me how. In 10 or 15 minutes or 20 minutes, the surgeon tells me that the operation is over with. In other words, that he is done and I have to awake the patient. Okay? I say, thank you very much, sir. That's good. And I switch off the gases and only oxygen to let the child come out from anesthesia. Okay? And I give him pure oxygen. If you give too much pure oxygen, the child doesn't breathe because it has to be
Brain
only
damage.
enough to have our respiratory system stimulated, okay? It has to be kicked out all the time. But the child doesn't breathe for some time, so but he's perfectly oxygenated but doesn't breathe. Eventually the nurse said, look, he is hypothermic, he's cold, because 7 pounds, the temperature in the operating room 16 degrees or 17 degrees because the surgeons are, in gowns, so they cannot work in the temperature as 25 degrees. It has to be cold. They will be overheat, the surgeons. So we wrap the child in the warm blankets and he started to breathe. And before he opened his eyes, he gave me a smile. A 6 weeks old give a smile because a child, such an infant can give you a smile, you know that. You didn't have children, but give you a smile. This is what makes a mother so happy, that the child gives you a smile after you nurse the infant, gives you a smile. So it was strange for me, why is he smiling when he was knifed? So I didn't understand it. The next thing is...
This better be good. Okay.
Okay. The next thing, he is knifed and we took him back to the recovery, give him to the nurses, and my work is over. I hand it over to the child, and the head nurse says to me, thank you very much, we don't need you anymore, you can just go to hell. Okay, she obviously didn't say to hell. We don't need you anymore. You go to...
Go home.
No, you go home.
Go home to Miramichi from battery,
yes,
right?
Yes. What happened? What happened, Charles? Here is the point.
You better be
The
a point.
nurse, the doctor was faking the surgery.
Excuse me for one. Excuse me. I'm on record. Can I strangle you right there? My
He
God.
faked the surgery. He didn't knife the child at all. He didn't touch the child. He let me to put him to sleep. He was pretending that there is a surgery, and there was no surgery. But here is the problem. He kept himself that he didn't hurt the infant because he was a good doctor, but let me to hurt the child with my inferior anesthesia. That's what he thought about, that my anesthesia is inferior. So in other words, the question to you, was he a terrorist? Obviously he was a terrorist, because he exposed the small child to my allegedly inferior anesthesia. But himself, he did nothing, okay?
You could have killed him.
No.
I mean, if you weren't properly
No.
trained,
Look, anyway, this is...
if you weren't properly trained,
No, you're missing the point. The point is, did you see the surgeon who is faking the surgery? Here's the point.
yeah, but
Okay?
I mean,
You could do it, Charles. we dress you in greens, you get you in drinks, you go to the operating room and you fiddle with your heads. The nurses will drape the patient,
Yeah.
and then
They want to know if
and then you
panic or if you
and
know
you
what you're
say
doing.
and you say, let I go ahead? Yes, go ahead, sir. Yes, okay. And you stand for 10 minutes, move around, and say thank you very much. And everybody's saying, thank you, Dr. Charlie LeBlanc. You did a great job. And you did nothing. You just was pretending. You were fooling around. Okay?
Yeah.
Okay. So now this is what. But the butlers didn't let me off the hook. Few weeks or few months later, I learned that the ENT, which is the ear, nose, and throat specialist from butlers, is coming to Chala.
Hold it, we'll get to that from my point here. Hold it. Just want to make sure. Got the coffee? No,
Okay.
just a little bit. We're going back to manners. Now, excuse me if I'm. Okay, so you